I'm Logan Crawford, and this is the award-winning TV show right here on Ebru, Fresh Outlook. We begin today with a look at the Ebola outbreak in West Africa and beyond. In the U.S., a doctor died this week from the deadly virus, but there are glimmers of hope, such as the words from UN Secretary General Ban Ki-moon, who says we can win this battle by the middle of next year if the world takes action. Take a look at all of the developments.
Dr. Martin Salia, a surgeon who contracted Ebola while working in Sierra Leone, has died of the disease at a Nebraska hospital. His is the second death from the virus out of 10 known cases treated in the U.S.
He arrived in very critical condition. In spite of that, we had nurses and doctors working literally around the clock to try to reverse his condition, but were unable to do so.
The 44-year-old doctor was the chief medical officer at United Methodist Kissy Hospital in Freetown, Sierra Leone. Salia was a native of Sierra Leone and a permanent U.S. resident who was suffering from advanced symptoms when he arrived at the Nebraska Medical Center.
He had no kidney function. He was working extremely hard to breathe, and he was unresponsive. He progressed to the point of cardiac arrest.
Salia was the third Ebola patient treated at the Nebraska Medical Center. His treatment included a dose of convalescent plasma and ZMapp therapy, as well as being placed on dialysis, a ventilator, and multiple medications to support his organs. The outbreak of Ebola is the worst on record. It has killed at least 5,177 people, mostly in Sierra Leone, Liberia, and Guinea, according to the latest figures from the WHO.
And we are back live on set now here at Fresh Outlook. I am joined by the Ebru think tank, Dr. Vincent Eletto, who is an ER doctor at St. Mary's Hospital in Passaic, Albert Goldson from Indo-Brazilian Associates, and Jackie Guzda, a media analyst from Western Connecticut University. And Doctor, I'm going to begin with you because this is your expertise. I went to the emergency room just 2 days ago, and I was greeted by someone who immediately asked me, question number one, have you left the country recently? So apparently emergency departments in the New York area are taking this very seriously.
Oh, yes, they are, and they're all being trained to use personal protective equipment. We all have plans on how we're going to isolate these people, where they're going to be brought, and further going forward, who they're going to contact, the CDC, the Bellevue Hospital, any of the hospitals that are equipped to treat this.
As a physician on the front lines in an emergency department, do you have any trepidations yourself about dealing with people who are potentially suffering from this illness?
I think every day we put ourselves on the line. Hepatitis C, hepatitis B, HIV, it's something in medicine you have to understand. You stand the risk of getting a disease.
And how do you deal with that?
Day by day.
Right.
You just live with it, knowing. I have great faith in the medical system. I believe that what's really needed with most of these patients is the supportive care, which they can't get in the underdeveloped countries. We have a lot of resources. We need fluids, we need oxygen. We need these things just to support us, to keep us going, so our body has time to recognize this virus and build the antibodies to it.
Jackie Guzda, this issue that was so much at the forefront of the national consciousness just weeks ago seems to have died down. It seems like there's not as much interest in Ebola anymore. Has the media demystified the disease, do you think?
Well, if you look at the timeline, you'll begin to see that the big Ebola crisis erupted just during our midterm elections. I mean, the mayor of New York City was talking about it. He was on a panel with the two governors of New York and New Jersey. People who have, by the way, presidential aspirations. And so they began to quarantine the nurse and the doctor and all that to keep us safe. It looked as if they were using the Ebola crisis for their own political gain. And while that might be true, while we all had fear in the New York area, over time we began to see that even though the doctor who had Ebola was on the one train. It did not transmit in that crowded environment. And so people's fears began to dissipate, while the use of fear could not be used for political gain anymore.
But Jackie, isn't the media to blame for this? Because we built up a story. Good evening. Tonight we're going to tell you about a doctor who rode the 6 train infected with Ebola. What does it mean to the people who rode with him and the people who drive that train? More at 6.
Look, I rarely support the media because they do sensationalize, and they sensationalize because people will tune in. But isn't the big thing that we need that information? We need to know where people who are stricken with Ebola have been, if they are walking and riding on the same tracks that we have been. And if we turn onto the news for this exclamatory entertainment, then isn't it the public's fault too? The media is just covering what is newsworthy.
And then pumping it up a little bit to sell papers and get ratings.
To get ratings, because
Absolutely.
That's the way the system works.
Albert, talk to me a little bit about the politicization of this disease. Jackie touched on it a little bit. It became an issue in the midterm elections, and I think we saw some of the biggest fearmongers in the country actually win elections because of it. What's your take on Ebola and politics and the politics of fear?
Well, what's happened is Ebola has turned into the perfect running mate for these politicians. Again, they basically jumped on this tiger. They, rode it as hard as they could. Again, fear is a big motivator for people to pay attention to them. They also took on almost a messiah complex. I am here to protect you. I am here to protect your community or your city because I have access to resources, and this is what I am doing to protect the community. So unfortunately, a lot of people, politicians, even particular business people, had jumped on this crisis for their own benefits.
And some of the worst things that are done by government to people are done in the name of keeping you safe.
Oh, absolutely. There are so many different elements today, particularly after 9/11, in terms of particular fears. We have terrorism situations, we have security issues, cybercrime, all these particular threats. And when you throw something like a potential pandemic in there, then that really gets people quite upset because, again, that's something that most Americans are usually protected from, but something like Ebola can really inject a real sense of fear and foreboding psychologically.
Doctor, tell me a little bit about the protocols that your hospital has in place. Have you had meetings with administrators and so forth to talk to you about what the procedures are if indeed somebody comes in, has traveled to a infected nation, and is exhibiting potential symptoms?
Yes, we had meetings, especially with the infectious diseases department, on the precautions we should take, everyone getting masked, of course, bringing these people into an area that's isolated and then taking them from there to another section where it's complete isolation, where they can receive treatment, where you would actually almost quarantine everybody else from getting this disease.
What do you think of the world's response to this crisis? Has it been adequate?
I think that the pharmaceutical companies have gotten on board, and I think they all have attempted to come up with some kind of treatment for this. And I think it's, let's face it, whoever the pharmaceutical company is that puts out this drug is going to make a fortune. So there's a lot of incentive here, monetary, and then you have your people who are true researchers who want to do this, and they will work 24/7. One of the things they don't have in Western Africa is the resources that all the developed countries have to go ahead and do this research, to produce it, to keep their labs open 24/7, and just keep working and working and working on it.
Jackie, what do you think that the media can do to highlight the dangers of Ebola in a responsible way and highlight the need abroad for things like protective gear, medical staff, and so on?
Well, that's it. We need to see more images. We heard about there being one bed for every 1,700 people in West Africa. That doesn't translate until we see those pictures. And until we see those pictures of, unfortunately, bodies in the street, the healthcare workers in their protective gear, trying to save these people, the message really hasn't gotten really home to the people in the United States yet. We had our fears and we were on the subway with our hand sanitizer and all that. But getting to the crux of this problem, we really do need to see what's going on in West Africa.
And it does seem like the American viewing public only cares when it's happening here.
That's the way it goes, isn't it? I mean, people work in their self-interest, not all the time, of course, but if it's going to affect me, then I'm going to pay attention.
Albert, talk to me a little bit about the governmental response, about the Obama administration response to this disease, the UN's response to this disease. Do you think there needs to be better and more coordination, or do you think we've finally gotten up to speed and that we're getting a handle on this? It seems as though in West Africa there are fewer and fewer outbreaks right now and fewer deaths.
Well, it depends on the reporting relationships in West Africa. The figures are going down. However, unfortunately, there are a lot of those with Ebola who are, quote unquote, hidden. They do not want to come out because they know they can't get the proper treatment. So they are really staying under the radar. With respect to government.
Which is frightening because they're going to stay under the radar and die and spread it.
Yes.
Yeah.
Unfortunately. As far as the governmental response is concerned, again, the world has tremendous resources, not only the United States. Most of the world has provided quite a bit of financing in terms of helping the situation, but they really need literally medical boots on the ground as far as doctors are concerned, as far as medical workers are concerned. And the math that turns out, I'm quite sure the doctor can support me, for each Ebola patient, you really need 4 medical workers per Ebola patient. So again, a lot of medical people are being trained right now. Hopefully they will be sent to West Africa to help out in those efforts. But because it's a high publicity and highly dangerous disease, again, greater coordination should be made with the World Health Organization, CDC, and any governmental help that is provided. So again, I'm quite sure the coordination is being improved, the protocols are being solidified, and I'm quite sure we'll see better collaboration, more effective collaboration in the very near future.
And doctor, we see hear a lot of comparisons between HIV and this disease, but this disease is actually much more virulent. You don't really hear about that many healthcare workers becoming infected with HIV, but you do hear about a greater percentage of healthcare workers getting infected by Ebola. So this is more of a threat.
When HIV first surfaced, it was highly contagious, actually. Understand that when you're contagious, you have a very high viral load.
Right.
And that's where you're going to infect other people. As we saw HIV patients in the 80s and the early 90s, they had very high viral loads, and I had one colleague who died because she was stuck with a needle from an HIV patient. But we learned how to treat it, and we did research, and we got the antiviral drugs. And it's the same thing with Ebola. We need to study it. If you see, we're beginning to understand we need to support you in order for you to give your body a chance to make these antibodies. Because it was West Africa and they didn't have all these intravenous lines, they don't have the oxygen to support you. Your body, you just continue to deteriorate until your body completely shuts down. You know, where is it that you reach the point of no return? We don't know that. And we're just getting a chance now to understand how we can treat this.
Jackie, final thoughts on Ebola?
I think that people in the United States can use this fear to motivate them to investigate and give money and look into this disease so that we stop it here. It sounds like I'm talking about a war, which I am, but stop it here and then go to the source and stop it there.
Albert, final thought.
Final thought, the pharmaceutical companies are really going to have to get very aggressive with this disease because something like Ebola virus does mutate. So by the time a particular drug comes out, it may be outdated to battle the virus that has mutated. So again, there has to be a real big push as far as research is concerned. Obviously getting the drugs out is critical, but you really have to look beyond that to stay on top of it so that we can contain this disease and hopefully resolve this crisis.
All right, that's a hope all of us share. When we return, it is almost the most wonderful time of the year and the shoppers seem to be ready. More on that after this.